Hello again, this is Brian Shaw. We are going to wait for about 2 more minutes for a couple of participants to come on board. So we will be starting very shortly. Okay, so everyone, hello. Good morning, good afternoon, or good evening. My name is Brian Shaw, and I am the Senior Research Manager at the Institute for Reproductive Health at Georgetown University. And on behalf of the Passages Project, as well as the Learning Collaborative to Advance Normative Change, we're delighted to be presenting today on costing, and costing specifically for normative change interventions. We have a great lineup of panelists at various stages in their costing experiences, and panelists will be moderated by Dr. Rick Homan, who is a scientist in the Health Services Research Division of FHI 360, and a close coordinating partner with the Passages Project. Before we begin, just some small logistical points. The webinar is 90 minutes long, and we will be doing about 1 hour of presentations laying out the costing experiences and challenges that the panelists have potentially run into, and then followed by 30 minutes of question and answer. So we will be handling sound from our end and opening up audio for that final 30 minutes of Q&A. However, feel free to use the chat function to log questions, and we will be attending them during that Q&A session. So with that, and not to take up too much time, I'm happy to turn the presentation over to Dr. Rick Homan, who will discuss costing experiences a little bit more, as well as introduce the panelists. Thank you.
Okay, thanks, Brian. So this is Rick. As Brian says, I'm at FHI 360. I'm based down in our North Carolina office. So it's nice if you all join. I was scrolling through the participant list. Some names I recognize, some names are new to me. So I've got some future potential colleagues, and that's great. But today's panel, I just wanted to introduce quickly. We have Francesca Quirke from the Tearfund, and she'll be talking about the Transforming Masculinities Project. Jennifer Gayles from Save the Children will be discussing Growing Up Great. Prashant Bhardwaj from UC San Diego will be talking about his work with the Reaching Married Adolescents Project. Sergio Torres Rueda from the London School of Hygiene and Tropical Medicine will be discussing his project with What Works. And last but certainly not least, Christine Michaels-Igbokwe from the Cummings School of Medicine in Canada will be talking about the SASA work she's been supporting. Next slide, please. So as Brian hinted towards this, but our objectives are for each presenter to describe the social intervention they're working with, discuss the goal and the intended audience for the cost analysis, discuss some of the challenges they faced in developing their cost estimates. And so those of you who have done costing before, that you understand that things don't always go the way you would hope. So we're going to have some discussion around that. Share their lessons learned and findings. I'm going to do a short just plug for the costing primer that we've prepared under the Passages projects, highlighting what it contains, but also trying to reflect back on some of the topics that are raised by the presenters, where the manual either might be able to serve as a resource to help, or we can discuss in the Q&A whether that's something else we want to try to bring into the costing primer. But the goal for the Q&A is really for all of us to learn from each other. So next slide, please. Okay, so this is Francesca, so I'm going to turn it over to you. And as Brian says, I'll be monitoring the chat if there's any questions or comments people have.
Okay, perfect. I was going to ask to be unmuted. That's great. Hi, good afternoon, everyone. So I'm Francesca Quirke, as Rick said already. So I'm based at Tearfund, which is in the UK, Program Officer in the Gender and Protection Unit. And so Tearfund is a Christian relief and development agency. So we're particularly looking and interested in faith and gender. So I'm talking, sorry, next slide, please. Next slide, if that's possible. Thank you. So I'm talking about the Masculinity, Famille et Foi intervention, otherwise called Masculinity, Family and Faith. And as Rick said, this is also called Transform Masculinities, which is the approach that Tearfund developed and uses to address gender equality, gender-based violence. But here it's adapted in the context of the Passage project to also look at family planning. So we are based in 17 Protestant congregations in Kinshasa in the DRC. It's a RCT, so we've got 8 experimental sites and 9 control. And the partners, as you can see, so Institute for Reproductive Health are doing the research and evaluating this approach. Tearfund, along with our church partner, Église de Christ au Congo, are doing the implementation. And then we have Association de Santé Familiale, or ASF, who are our DRC-based health service partner, who are creating that enabling environment as part of the project. Next slide, please. Thank you. So yes, our 2 aims are to reduce intimate partner violence and to increase the use of modern family planning methods. And what's being tested in this pilot is the effectiveness of engaging faith leaders and faith communities to address social norms that influence intimate partner violence and family planning methods. And as you can see, the graphic, so we're thinking about what are the social norms that are shaping these things in the faith community. And the target population is newly married couples and first-time parents. So we're trying to capitalize on these significant life change moments to reshape these social norms. And our target age is between 18 to 35 for the female partner, but recognizing the difference in age, no upper limit for the male partner. Thank you. So I don't know how clear this graphic will be for you, but these are the different component parts of the intervention. So as I said, we're working with faith leaders, Protestant faith leaders, and we're working at 3 different levels, national, regional, and congregational. We take them through a series of workshops, which are self-reflective, looking at gender equality by interactive activities and biblical reflections, trying to kind of work through the worldview of the communities that we're working in. Faith leaders then go on to select gender champions from the different congregations who may have a position of influence, leadership in the community, so youth group leaders or prayer group leaders, and we train them through the same process to be able to facilitate community dialogues for newly married couples and first-time parents, which are addressing issues of gender inequality, intimate partner violence, and family planning. And then also we're reaching the congregations, the normative environment, through diffusion activities. So the sermons of the faith leaders that are supportive of gender equality, other couples who give testimony at the kind of front of church, talking about the changes that they've experienced. So the idea is that we're also hoping to shape the wider congregation as well as target population. And then ASF are providing support through the clinics, and they also do presentations on family planning. So in the community dialogues, we have 8 weeks where the couples meet. In the first 5 weeks, men and women meet separately to discuss the topics that are that you can see below. In the 6th week, men and women rejoin their partners, and then in week 7 and 8 they discuss family planning and good parenting from a faith perspective. And in the 8th week, ASF come and do family planning presentations. They do the kind of technical input, invite people to their local clinic, give referral cards, and then these referral cards we track to see the difference between the control and experimental sites in accessing clinics and then taking up a modern form of family planning. Next slide, please. Okay, so in terms of the cost analysis, so as it says, we're interested in working with church partners. We're interested in the cost of sustaining what's already begun, but then of also replicating this, of scaling it up. The Église du Christ au Congo, the Protestant, it's an umbrella network. It has hundreds of thousands of churches throughout DRC, so think about scaling up within that system as well as replicating in others. So as implementers, that's the approach that we took to looking at our costing. And as I said, we're interested in scale-up congregations and other organizations, other implementers, to be able to access and use this information. Next slide, please. So in the first and second year, we collected our data retrospectively. And then in this current year, in year 3, we've been doing that concurrently, and we plan to continue that as well. So just to kind of give an idea of time frame, which I realized I didn't, year 1, we were kind of essentially setting up. Implementation began the very end of year 1, beginning of year 2, with the community dialogues starting February 2017. So they've been running, this is the 5th cycle that they're in. And so this is our 3rd year. And in terms of collecting the data, so we use this from our financial reports, and then, as I say, cross-check with activity plans. We looked at it, the project manager in DRC, and then also with my reviews as well, to make sure that we were thinking about other aspects that might not have been captured in the financial reports. For example, the shadow costs, the in-kind or donated input. So in this sense, because we designed the intervention to integrate within a church structure, to mirror other forms of activities in church life, for example, different types of prayer groups or men's and women's groups, the idea is that it would use kind of church resource in terms of church spaces for meetings, and volunteers that are part of the kind of normal way that the church functions. So we wanted to assign shadow costs to those, to also capture those costs, make sure they were recorded. And then, labor costs were measured as a proportion of time. So we probably, when we come to do a bit more of the analysis, we'll look at them pulled out, but also kind of assigned to the different activities. Next slide, please. Thanks. So yeah, just to say, I know that different people in this webinar are at different points with this, but we're really, I guess, at the kind of data collection, and then we're thinking about the different analyses that we want to do to be able to better understand the data that we have. So as I've said, so we'll look at the different phases in the implementation, look at what were the higher cost areas, and also to kind of pull out which are, okay, I see that. So we, so we're looking at which are the one-off costs versus the recurring costs. Obviously, kind of some of the high intensity one-off costs for the different resource development, the toolkit and so on. And then we also want to understand, so these shadow costs are assigned to working through churches, how might those differ from working through a different structure? Next slide, please. this is the last one, so hopefully I'll be in time. So learnings to date. So I'd say the key thing that we found is staff turnover. We wanted ownership of this process to sit within the DRC with our colleagues there, but with support from us. But we perhaps didn't recognize kind of the context that they're working in. A lot of our staff are in the east of the country and often had to be sent off to remote locations. So just to highlight the need to train multiple people, since this isn't something that a lot of people are familiar with in our organization. So to get the knowledge out there so that when there's changes, we can continue. Again, communication between the finance and the program staff to make sure nothing's lost in those finance reports. And then just to highlight again, competing priorities, it was complicated for the program staff in the midst of problem solving, different things were arising with the kind of, I guess, what they might think of as business as usual of the project. It was hard to kind of highlight the purpose and the goal of the costing and why it's important. Thank you very much.
Okay, thank you, Francesca. We now are going to shift to Jennifer Gayles from Save the Children, talking about the Growing Up Great intervention, which is also in the DRC. Jennifer?
Thanks, Rick. Good morning and good afternoon, everyone. I'm Jennifer Gayles. I'm an adolescent sexual and reproductive health specialist here at Save the Children in Washington, D.C. I'm happy to be here presenting our costing work today. And I just want to mention that the implementation and evaluation of Growing Up Great is a collaborative effort between Save the Children, who's implementing the Global Early Adolescence Study, that's led by Johns Hopkins University, which is evaluating the intervention, and the Institute for Reproductive Health, which is our prime for the Passages Project. Next slide. So Growing Up Great is an intervention for in-school and out-of-school very young adolescents, their parents, and other influencers, and it's located in Kinshasa, DRC. It uses an ecological approach to provide information and address social and gender norms related to sexual and reproductive health. The objectives of the intervention are to increase very young adolescents' knowledge of puberty and sexuality development, to increase gender equitable behaviors, and to increase the use of family planning and other sexual and reproductive health services as very young adolescent participants age into older adolescents. The costing study that I'm presenting today is from the preparatory period of the project, during which we adapted a package of existing evidence-based approaches and materials to the Kinshasa context and conducted other formative activities prior to launch of the intervention package. You can see on this slide the resulting intervention package. Many of the materials for the very young adolescents, like the storybooks, activity cards, and the game, were adapted from the Gender Roles, Equality, and Transformation, or GREAT project, which was implemented in rural Uganda. The parent materials, the testimonial videos, were adapted from the Voices approach, originally piloted in Nepal, also a rural setting. But other elements like the puberty books, the teacher guide, and the health provider materials were developed specially for Growing Up Great. Next slide. So all the data in this presentation were collected and compiled retrospectively with these two goals of estimating the cost of adapting the package and estimating the cost of other preparatory activities prior to the intervention launch. Another prospective study is currently underway to cost the implementation. The expected outputs of the study were fairly modest, given that the costing was added to the project scope of work a little late, and that the retrospective process generally requires more estimation. We have already calculated costs per activity and are also working to determine the cost per cohort for in-school versus out-of-school very young adolescents. The latter measure has required some additional consideration about how to divide costs that support both activities for both cohorts. So for now, we've chosen to allocate shared costs to each cohort based on the number of program participants, but we're finding that that doesn't necessarily provide an accurate picture of how time-intensive the work with out-of-school cohort has been. So we continue to explore different solutions for applying those costs. And generally, our results are intended to benefit other programmers and government ministries interested in taking up the intervention in other or similar contexts, and our own team as we look to scale up in DRC. Next slide. Thank you. So we pulled costs from a variety of sources to give us the most precise cost data available. Where possible, we pulled directly actual costs from expense reports or partner financial reports, and at times planning documents like meeting and workshop budgets, procurement quotes, and other standardized forms were also a valuable source of near actual direct costs. To calculate staff costs, we asked program staff to estimate their individual LOE per activity using a specially designed Excel sheet with standard categories to ensure consistency across headquarters and field staff reporting. Administrative support staff at the field level weren't able to disaggregate in such detail, so their total LOE was pooled for the entire period of the retrospective study and then applied across activities based on each activity's weight in the total direct costs. Partner costs were the most challenging to estimate because costing activities weren't part of their scope of work, so it was hard to extrapolate detailed cost data. Additionally, costs varied by in-school versus out-of-school partners, and their financial reports were often significantly different from their monthly budgets. So as a solution, we decided to review organizational budgets and submitted expense reports to determine a monthly average per type of partner during different periods of the retrospective study. For example, we were able to determine that a number of partners received approximately $500 a month during the first months of project activity, and closer to $1,000 a month as adaptation of materials and partner orientation began. And then we drafted a written description of what that monthly average covered to accompany the lump sum amount. Next slide. Next slide, please. Thank you. So each type of cost category was tracked across several activity categories, which you see in the left column here. And each of those categories is then comprised of a number of individual activities, which you see in the right column. The adaptation and printing included all costs related to translation, content revision, pre-testing, and also contractual services for a local illustrator, graphic designer, and videographer. The social norm exploration is something unique to social norm change activities, and it was something that helped us to ensure our approach and toolkit were targeting the right social norms in an effective way, and that we were engaging the most important reference groups for VYAs. So that activity required adaptation of a tool to make it more appropriate for use with VYAs, running of participatory activities, and some analysis afterwards. Partner capacity focused primarily on staff training on gender and social norms, the different elements of the intervention, and monitoring and evaluation. The health system support is just another way of expressing the youth-friendly health service training that was done for providers and staff at pre-identified health centers located close to our intervention sites. That training was led by PSI with support from IRH, so our contribution was mostly to support partner participation. Project framework included LOE-heavy activities like developing our theory of change, our results framework, and a monitoring and evaluation system, among others. And then advocacy is more of a catch-all category for the formal project launch and other high-level meetings with government officials, donors, and other networks. Next slide, please. So here is a snapshot of our results. The pie chart shows total cost allocation across activity categories. So that includes direct costs, staff costs, and partner cost for each activity category. As you can see, adaptation of materials is by far the largest category. Adapting two different sets of materials, one from Uganda and one from Nepal, both rural settings, required some higher staff LOE. And there were also some elevated direct costs related to creation of new materials like the puberty books. Thank you, Leah. I see your note. So some of you may be wondering what these percentages mean in actual amounts. We actually decided not to focus on dollar amounts here because we don't feel it's representative of what it would cost to adapt the intervention to a different context. Kinshasa is a notoriously expensive urban area, and we are conscious of how that may have affected our costs. We are also we essentially adapted the package twice, once into French for the in-school cohort and once into Lingala for out-of-school VYAs. So subsequent adaptations should be a much lighter lift, considering that materials now already exist in English and French for both rural and urban settings. And then just to sort of note that partner capacity building and development of the project framework also comprise significant portions of the total cost. Next slide, please. So our biggest challenge in completing this study was the fact that the project was not set up to do costing from the beginning. So big lesson learned for us. Most of our other challenges stemmed from that overarching issue. In particular, allocation of staff time and other resources needed to compile and analyze the data required a lot of teamwork and some thoughtful division of responsibilities across our team. We often joke that we needed an activity category just for costing. The late addition of costing work also affected our ability to measure some costs, especially those around administrative support staff and partners. And we also faced some difficulties marrying different administrative and finance systems at HQ versus field level. And we weren't able to collect any disaggregated cost data from partners. If costing had been envisioned and planned for from the time of project launch, we might have been able to set up systems to facilitate some regular collection of cost data and reduce those challenges. And then one additional point that we've been reflecting on is whether this type of costing is valuable, or how it's valuable is maybe a better way to say that. Of course, costing in and of itself is a useful tool, and we certainly understand why people want cost information, but we've found that our costs for Growing Up Great are really context specific and really dependent on local implementation structures, like the complicated mix of public, private, and parochial schools, and the relative lack of community-based groups focusing on our age group. So that might limit how others are able to use this costing information. Luckily, our costing journey doesn't end here. The study that I'm presenting now is just the first part of a combined costing study. We're currently engaged in a prospective costing of the implementation through the end of this current school year, and we'll have additional data to complement this data set later in the year. So with that, thanks to you all for your attention, and I look forward to answering any questions.
Great, thanks, Jennifer. That was very helpful. And once again, a reminder for folks: if you have comments or questions, please type them into the chat box so we can use that as our kickoff point for the discussions to come. But now I want to shift to the next project. So if we go to the next slide, please. And that would be Prashant Bhardwaj from UC San Diego. And he is going to share with us his work on costing around the Reaching Married Adolescents project. Prashant, over to you.
Thank you so much. It's absolutely wonderful to be able to talk to everyone here. I'm Prashant. I'm an associate professor of economics at the University of California in San Diego. The Reaching Married Adolescent project is basically the brainchild of Pathfinder International. And I should point out that at the end of the first hour here, I have to leave for a thesis defense for one of my students. But for the Q&A, you'll be in the hands of Bram Brooks, who's the research and metrics coordinator at Pathfinder. So he's in the audience and he'll be able to answer most of these questions. And he really knows a lot more about the project than I do, to be honest. I'm part of the Center on Gender Equity and Health at UC San Diego, and we are sort of the folks that are doing the costing as well as the cost effectiveness for this project. So I'm going to give you a brief overview of what the goals of the RMA are. So this started in January 2016, and it's scheduled to end in August 2018. So it's about a 2-year project. And this was developed based on the need to address social and gender norms, as well as individual attitudes and behaviors, in order to increase family planning use among married adolescents in Niger who are between the ages of 13 to 19. So that's sort of the target population that we have in mind. And we thought this is a fairly critical opportunity to learn more about which interventions are most cost effective and why, and to try to make progress on sort of understanding individual pieces of these interventions. So as you'll see in our overall sort of program setup, we have multiple intervention arms, which is going to create some really tricky issues from a costing perspective. But from sort of a broader intellectual perspective, this is nice because then we can try and think about which of these types of interventions are most effective, as well as sort of cost effective. So the primary outcome that we're interested in is in the increased use of modern contraceptive methods among married adolescents across 3 districts in the Dosso region of Niger. And we think that we're going to sort of reach this goal by trying to improve various points along sort of the theory of change continuum. So thinking about stuff like increasing knowledge of contraception, increasing supportive attitudes toward contraception, increasing the intention to use a contraceptive method, then providing agency or sort of enabling the agency to use contraceptive methods. And these factors we imagine will finally lead, or we sort of theorize will finally lead to increased use of a contraceptive method. And the evidence that we're going to generate from this on the effectiveness as well as the costs, we're hoping to share with the Ministry of Health and other key stakeholders in 2018. The districts we're in within the Dosso region are Duchi, Loga, and Dosso. And our implementation partners on the ground are Lafia Matassa for the community-based implementation, and of course we on the at UCSD, the Center for on Gender Equity and Health will be in charge of the research and evaluation component. The intellectual sort of component of this project, so the best practices that Lafia Matassa is using on the ground comes from Camber Collective. Yeah, next slide, great. So let me describe the study in some detail. The study is going to have multiple arms, as you can see, and each district is going to have one type of intervention. Across all 3 districts, as you can tell, there's going to be some components that are common, and that's what's sort of highlighted in the green dashed box. So all of our intervention arms are going to have 2 components that are common, and these are basically components 1 and 2. Component 1 being sort of youth-friendly service training for health facility staff and service providers. And component 2 is going to be conducting community dialogues with village members. So these are going to be common across all 3. What's going to be different across the 3 is going to be basically a component 3, what we call component 3 and 4, where Loga is going to get component 3, which is going to be household visits by the community health workers. So these are household visits for married adolescents and their partners, and husband visits are done separately by male community health workers, and female visits are done separately by female community health workers. So that's going to be component 3, which is going to be present in Loga. And then in Duchi, we're not going to have component 3. We're not going to have these household visits, but we're going to instead do small group discussions with peer mentors for married adolescents and their partners or husbands. Again, these small group discussions will be done separately, or are being done separately by male and female mentors. So that's going to happen in Duchi with the small group. And in Dosso, we're going to have both components 3 and 4 together. And that's going to be sort of the way to think about, the different outcomes that we're going to achieve in these 3 districts will hopefully be, be differentiated by the fact that in Loga, we have just the household visits. In Duchi, we have no household visits and just small group sessions. And in Dosso, we can have both household visits and the small group sessions. Okay, next slide, please. All right, so the costing question we're trying to answer, and is something that has been on the books from the beginning, is basically trying to understand what is the per adolescent cost of this intervention at the district level. Now, at the district level, again, it's crucial because the interventions themselves are slightly different across the 3 different districts. So what an adolescent receives in Doso is slightly different from what she's going to receive in Loga. We thought this was the right metric to sort of think about in this context, because if we think about scale up of this project, the way we thought would be easy to express costs would be to think about going to a region and understanding the demographics of a different region by just looking at how many, what the potential target set would look like in that region in terms of the married adolescents between ages 13 to 19. And then if we had a per adolescent cost of different interventions, then we could think about how much that would cost, how much this project would cost in terms of implementing it in a different region based simply on the demographic structure of that. Now, you'll note that one thing we're assuming, or at least not dealing with in this approach here, is the question of what infrastructure we're already building on. And it's to be noted that Lafia Matasa is obviously building on a existing structure of community health workers and so on. And we're going to only think about scale up in places where this existing infrastructure already exists. And now I know I'm making a fairly generic point about all costing. I think everyone that does costing suffers from this sort of issue of whether to think about scale up in places where some baseline infrastructure already exists, or are we having to create the baseline infrastructure in the first place. And as most economists are also sort of concerned with issues about economies of scale, one can think about as the scale up increases, we will have sort of assumptions in place to think about whether we have economies of scale, which lowers costs as we expand, or diseconomies of scale. There's some interesting evidence we're seeing from the budgets of Lafia Matasa to suggest that there may be sort of convex costs that are at play here that we need to look into a little bit more. I'm going to get to that in a second. But so the basic costing question that we're sort of grappling with is the per adolescent cost, but thinking about keeping or assuming a baseline set of infrastructure upon which we will do the added training of the community health workers and so on. So the intended audience for these results is our policymakers, researchers, implementing organizations, and so on. And we're taking on the perspective of the program implementer when we're doing this. And all of this is very much concurrent data since we've been thinking about doing the costing from the very beginning of this project. Next slide, please. Okay, some details. I'm not providing any numbers here because I always worry in this day and age of putting down numbers and showing numbers to people, and that's the one that sticks in everybody's mind. We have a ton of really nice detailed budgetary information from Pathfinder and all of the subcontracts that Pathfinder has given out. So we have very detailed budgets from Lafia Matasa, which really is going to help us a lot in figuring out the costing, and actually makes the costing job tremendously easier once we have these kinds of detailed budgets. We also have monthly performance monitoring data. So these are data like, talking about how many people show up to the small groups, how many household visits were made, how many community health workers were involved in a given month in a given area. So it's very detailed sort of monitoring data at the monthly level that has been collected since the project started. So we're going to be using this as part of figuring out the costing. We're also doing household surveys. Now that's sort of the stuff that the Center on Gender Equity and Health is doing. And I'll tell you why we need the household surveys. Usually it's not that common perhaps to use household surveys in costing, because really what you're concerned with is getting the cost from the implementation side. But I'll tell you why we need it in a second. Labor costs are really nicely, again, documented in all of the budgets, especially the Pathfinder budgets are incredibly detailed about how they include labor costs and as percentage of time and salaries and benefits. So this is all really well documented. Capital investments are also in sort of the usual. Pathfinder has spent on, say, motorcycles and cars in the region. Of course, at the end of the project, they are typically sold back, and so we can assume a certain depreciation, or just simply get the cost of how much the vehicles were sold for, and then sort of deduct that from how much was spent on them. So we have all this kind of information which we're going to use to get at sort of the capital investments and apply some sort of a discount rate and try and get at the per child and per time unit involved of capital use. There were no donated or in-kind inputs that we know of, so that's not a crucial component for us. But despite all this great data that we have, and despite the foresight that Pathfinder had in terms of including costing as a key component of all of this, there are a couple of interesting challenges that we face that I think, again, I think would be germane to projects like these where you have multiple arms being implemented by the same implementer. And so one thing that we're facing right now is thinking about how do we apportion all the costs at the district level. So we have costing from Lafia Matasa and from Pathfinder about how much they spent on vehicles, but we don't necessarily know just yet how much these vehicles were used in each district. Now, for some of these, for example, general paper costs or general sort of research manager costs or things like that, we could just apply it uniformly across the three intervention arms. But the third intervention that has both the community and the household visits, the sort of small group and the household visits, clearly has more costs associated with it. And then how do we then apportion some of these costs to indicate that it's more costly to do one of these interventions than the other? And this is where it was interesting to see some of the convex costs that that may be at play, where it's not a simple linear combination of costs from components 1 and 2. If it is all linear, again, then it's easy to sort of just use a simple division metric to figure out how much what the costing looks like in each district. But the concern is that it's not linear. And the reason we think that that's a concern is when we look at the budgets from Lafia Matasa, the expenditure in the third district in Doso is much more than the total cost of doing the interventions in Loga and in Duchi. So, it could be that the cost of living in Doso is different and so on and so forth. It's unlikely typically in these settings, at least at the district level, you don't see a tremendous difference in sort of cost of living, but it's definitely something that we are thinking actively about going forward as to how do we think about distributing these costs across the districts. Again, for some costs, it's very obvious how to do this, but for some, it's going to be much trickier, and we're going to have to make certain assumptions about how the sort of linearity of these costs. The other issue that we face is in the small groups, and in the household visits. So far, we have not been able to collect data on how many unique adolescent visits were made. So what we have is data on how many girls show up or how many girls were visited every month. But we don't know if the same girl was being visited every month. And that's crucial to know from if the objective of our costing is to understand the per adolescent cost. So this is going to be fairly tricky for us, but this is where the household surveys come in that when we do the N-line surveys in August, or towards the fall, basically, we can use the household surveys to ask if an adolescent girl has ever been to any of these, if she's been visited at home, or if she has attended these small group meetings to to sort of recover the unique number of people that have been affected by this program. So that's actually fairly crucial when thinking about the per adolescent cost of this intervention. So those are the two sort of main challenges we face. And of course, then the broader challenge, which I think every costing person has to face with are the thoughts about whether we are piggybacking on existing infrastructure or not. And that's something that, as I said before, we're clearly not, we're not doing a costing for setting up infrastructure in a broad way. We're going to assume that the basic infrastructure of community health workers exists in places where we want to expand this program. So that's where we are right now. We have a bunch of the numbers. I didn't want to put any numbers up for today, mainly because we're still trying to figure out this sort of how we divide across these 3 districts.
Okay, thank you, Prashant. That was very interesting. I tried to Google yesterday to find out more about your project, but clearly this was a more efficient way for me to get this information. So thank you for that. And I understand you're going to have to run, but your colleague is going to be here for the Q&A. So we appreciate you providing that support. I'd like to now shift to Sergio Torres Rueda from the London School of Hygiene and Tropical Medicine. He's going to be sharing with us some of the work he's been doing with his colleagues and others on the What Works program.
Great. Hi, everybody, and good afternoon from London, and good morning and evening wherever you may be. So I'll be talking about the What Works to Prevent Violence Against Women and Girls project that we're doing here out of LSHTM. Next slide, please. Great. So just briefly, the rationale for this program generally is the fact that violence against women and girls is an enormous problem at an enormous global scale, with 1 out of 3 women being physically or sexually abused during their lifetime. And the objective of this large program is to produce rigorous evidence on what works in reducing violence. The program is funded by DFID, by the Department for International Development here in the UK, and it is a very big program. They've invested about £25 million in it, and it is a program with several components. One is looking at prevention interventions. One is looking specifically at violence against women and girls in conflict zones, and one is looking at the social and economic costs of violence against women and girls. What we are working on specifically is that first component, the prevention interventions. Next slide, please. Great. So of those prevention interventions, basically there are 15 interventions running under What Works in 13 countries, spread over Africa and Asia. The interventions are all being run by NGOs, and they're all paired with academic institutions who provided some advice on intervention delivery and also on evaluation plans, and ensuring that the intervention was amenable to some sort of evaluation as well. There's a research component of it, measuring effectiveness. Some of the interventions are being looked at through randomized controlled trials, others through experimental and quasi-experimental methods, and a couple of them actually are only being evaluated through qualitative means. In terms of our work here at the London School, we've been tasked with doing economic evaluations in 5 of the interventions that are now being evaluated through randomized controlled trials. That's being carried out by a team here at the school, Julia Ferrari, Anna Basel, and myself, and local health economists in each of the 5 countries. Next slide, please. So I won't go into too much detail on this slide, but the 5 countries that we are costing and doing economic evaluations in are Ghana, Rwanda, South Africa, Zambia, and Kenya. They are a rather large, they show a rather large range of kinds of interventions and settings. They're in rural settings in Ghana and Rwanda, and in urban settings in South Africa, Zambia, and Kenya. The kind of intervention varies by country. In Ghana and Rwanda, the interventions are community-based social norms change interventions. So that largely rely on training volunteers in the communities to do activities, to do some counseling, to do some referrals. In the case of Rwanda, that is done by initially training married couples who then go on and train others and do different kinds of activities. In the other 3 countries, they're more workshop or classroom based. In South Africa, the workshop is based on improving personal skills with a focus on employment. In Zambia, the workshop is more around substance use reduction with psychotherapy focus. And in Kenya, it's classroom-based for self-defense for girls and teaching boys about positive forms of masculinity. The target populations for these interventions varies. Ghana and Rwanda, the target population is actually the community at large in rural areas. In South Africa, it's late teens and young adults, both male and female. In Zambia, it is families composed of husband and wife and a child. And in Kenya, it's girls and boys in primary and secondary school. As I said, they're all being implemented by local NGOs, sometimes several NGOs within one country, which for the costing perspective makes things a bit more complicated. And I'm personally in charge of Ghana and Rwanda, so if you have questions about that, I'm more than happy to answer. My colleague Julia is dealing with South Africa, Zambia, and Kenya. So those are, I know a little bit less about them, but I'm happy to try to answer questions on that as well. Next slide, please. So since we're doing a cross-country study, we had sort of perhaps aims that could be looked at across the different settings. So in terms of the economic evaluation, the question that we're looking at is what is the value for money of the different what works interventions? So this is essentially looking at the cost per case of violence averted and the cost per disability adjusted life year averted. This is, you know, a cost effectiveness or cost utility framework, but within actually just the costing, we also are looking at different things. Two of the main questions that we're looking at in terms of just the costing is how do these unit costs vary by setting, by type of intervention, and by size. So unit costs, so perhaps cost per person reached. And then in terms of the, what are the unit costs for intermediate components, we want to know in each country how much does it cost to, for example, train a volunteer or run a session in all the sort of intermediate components that are comparable across countries. The work was commissioned and is being paid for by DFID, so they are very interested in understanding more about the costs of gender-based violence, as it seems to be an area that they would like to invest in the future, and they would like to know which interventions they should invest in. We also are working to eventually present the results to domestic policymakers. With the issue of gender-based violence, it's a bit of a tricky thing because I suppose the effects, but also the causes can be looked at from a number of different angles, which means that it's a bit of a multi-sectoral issue. So there's policymakers who are interested in it in the Ministry of Health or Ministry of Gender, Ministry of Education, etc. So we're looking forward to presenting to policymakers of different kinds. Implementing organizations are also quite interested in it, particularly in issues of scale-up. Yes, in issues of scale-up and other issues related to that. And then there's also an academic interest. We are sort of also developing some methods work in different areas. Next slide, please. Great, so the perspective used for the analysis is the provider perspective at the moment. However, we do advocate a societal perspective where possible. We started doing this work sort of a little bit kind of halfway through when the interventions were running in some countries. So we needed to perhaps scale down what we would have ideally done, but we advocate more of a societal perspective to include user costs. We are still collecting data. As I said, we started at different points in different countries, and in every country, each intervention runs on a different timeline. So in some countries, well, in all countries, we had to collect startup costs retrospectively. In terms of implementation costs, in all countries, I believe we did manage to start collecting costs before the intervention ended, but in some, we just had a short period of time. In others, the interventions are still running. So we have we're both doing concurrent and retrospective at the same time. Next slide, please. So the sources for the data used in the cost analysis were, well, a number of different sources. And I think I should mention that we are in the process. So before we started this work, we sat down and we really carefully thought about what kind of costing we wanted to do. And so we wrote a master protocol for all the 5 countries, which then we narrowed down into individual protocols. And coming from that process of writing those protocols, we are going to be writing, or have written a paper that is currently being reviewed by the authors in terms of sort of best practice of doing gender-based violence costings. So we hope to have that as a resource in the public domain fairly soon. And Christine, who will be speaking next, also is a co-author in that. So yeah, so in terms of the sources of the data used in the cost analysis, our first approach was to do initial interviews to understand the scope of the intervention. And we spent a lot of time developing sort of intervention description sheets to really kind of capture, because these are interventions that have many moving parts. So we really needed to sort of make sure that we capture all of it. We then went through financial records, accounts, and asset registers. We did interviews to determine allocation of different goods, but also time use by staff. We did some direct observation looking at time use of different staff members or volunteers, and we looked through program records as well, monitoring and evaluation records and reports to know frequency of certain activities and vehicle logs, etc. In terms of labor cost measured, our costing is an economic costing, so we're both capturing all the paid staff and volunteers, which is interesting because some of these, as I said, some of these sort of community-based interventions have an enormous number of volunteers, and they are really the pivotal thing in this intervention. We took a macro costing approach, and we tried to, as much as possible, use when we could observations, and if not, then we use other kinds of time use data like interviews and timesheets. For paid staff, we use salary information, and for volunteers, we are doing two methods to understand those costs. One is the replacement price, so the cost of substituting a volunteer by sort of what the next most similar profession would be. This is a fairly standard method for community health workers, but the issue with volunteers who work in gender-based violence is that they tend to have jobs that are not necessarily, that are quite multidisciplinary. They can be part counselors, part community health workers, part teachers. So it's we're trying to sort of do some work looking at how do you aggregate those different professions and how do you find a substitution cost. And then we're also looking at the opportunity cost. So in terms of looking at their salaries in their regular job and substituting a cost for that. But the preferred method and the one we're advocating for at the moment is replacement price. Next slide, please. In terms of capital investments, we looked at capital goods, vehicles, computers. Most of these interventions are not very capital good intensive. They're, as I said, often volunteer or staff intensive. And we annualize those capital goods in the currency year, which we set for 2018 to be able to measure across interventions. We looked at a useful life per capital good, and we applied a 3% discount rate. And we'll do some sensitivity analysis around this. So as I said, this is an economic costing, so we're looking both at donated goods and financial records, so we're presenting both. And in terms of the challenges, I won't go into them too much because we're still collecting data, so we don't actually have challenges for the analysis yet. But we imagine that what some of the issues are around standardizing unit costs across settings. How do we standardize them so they're specific enough but also comparable? How do we interpret differences in costs, which some of you have brought up? What is the role of price levels by country? In terms of coordinating analysis across sites and ensuring standards are applied equally when working with 5 different economies. So we're trying to do, in a few months, doing some workshops to bring everybody together and make sure we're all applying all the principles in the same way. Next slide, please, which I think is the last one. Almost the last one. And in terms of cost data disaggregation, we developed a costing tool, which we hope to make public quite soon, that actually is quite automatized, and it helps disaggregate the cost data as entered by phase, startup versus implementation, by calendar year, by input type, so by staff, supply, transport, etc., by implementation site, by funding source, by activity, and then by sub-activity of the intervention. Next slide. or I think maybe that's it. No, almost. So we will be presenting the results in the local currency, in US dollars, and then in pound sterling, since DFID is our funder. Secondary analysis plan, well, we'll do the economic evaluation, so cost effectiveness, and we'll hopefully be modeling for scale up and do some cross-country comparisons. I think that's it.
Okay. Well, thank you, Sergio. Sounds like you got a busy workload in front of you.
Yes, indeed, indeed.
The first one with multiple countries, which brings a whole nother nightmare. It'll be worth it in the end. Okay, we're running a little bit behind, but I want to make sure we give proper time to Christine Michaels-Igbokwe, who's going to share with us her experience working with the folks on the SASA study. So Christine, over to you.
Hi there. Thanks so much for having me as a part of this webinar. I'm going to talk about the SASA study. This was specifically a community cluster randomized trial. So it's a little bit different than I think costing just an intervention, but I think others have talked about trials as well. The trial took place in Uganda I think it ran from 2007 to 2011 in 2 administrative divisions in 8 communities, which were pair matched and randomly allocated to intervention and control. The approach was community mobilization aimed at stimulating change at the individual, relationship, community, and society levels, with the objective of preventing intimate partner violence and reducing HIV risk. SASA, the word SASA means now in Swahili, but it actually is also an acronym for the different stages of the intervention. So it's start, awareness, support, and action. And the idea of the intervention is to take communities through these phases step by step with different materials for each of the different phases. The target population for the prevention of the target population was the community members, but we were looking at the outcome of prevention of past year experience of intimate partner violence. And this outcome in particular was measured amongst women aged 18 to 49 years old who had been in a regular or casual partnership in the past year and who lived in a census enumeration area in which there was a SASA community activist operating. This is probably a conservative outcome measure because in reality, we think that people outside of this age bracket and beyond the boundaries of the enumeration areas would have been reached. But since this was part of a trial which was aimed at measuring intervention effects within a specific population, this is what we used for the cost effectiveness as well. The program materials were designed by Laurie Michaud at Raising Voices, and she developed the materials between 2005 and 2008, and then the intervention was implemented by CEDAVIP, and these are both Center for Domestic Violence and Prevention, and they're both local NGOs in Uganda. Next slide, please. So for the cost analysis, we estimated the unit costs per activist supported, cost per community member in intervention areas, and the cost per SASA activity. And for the cost effectiveness, we estimated costs per case of physical intimate partner violence averted as measured by experience of violence in the past 12 months at N-line. The intended audience for the results were policymakers and other implementing organizations. There was actually, by the end of the SASA study, nearly 100 organizations that were already using SASA materials and rolling them out in a variety of different settings. For the cost analysis, we adopted a payer's perspective, and the data collection was all retrospective. Next slide, please. I used, I guess mainly I used financial records and annual reports for financial costs. Economic costs, I used estimated replacement costs, and then for capital items, annualized them over the expected useful life using a discount rate of 3%. Activist and community member time, I estimated the value of that based on the local cost of an unskilled laborer, like a temporary unskilled laborer position. And this was because the majority, or actually really I think all of the community activists were not otherwise employed. And otherwise I think we would have looked at replacement costs as well, as Sergio mentioned, but in this case most of the activists were not otherwise employed. But we varied this in the analysis, so we varied the discount rate for annualization, and then labor costs we reduced to 0, so assuming that activists' time was free because they were volunteering, we used a value of 0, and then we also doubled it. And that was in the sensitivity analysis. For labor costs, staff time was estimated based on individual interviews. So I interviewed all of the available staff, and unfortunately at the time that I was there doing data collection, the intervention had already finished, and so I couldn't interview activists themselves. But with the staff, we sort of came up with an average length of time for the different types of activities that activists were and community members were conducting, and so that length of time was applied to the economic cost of labor for community activities. Next slide, please. Capital costs for physical space. The office of the two implementing, or sorry, not one implementing organization and then Raising Voices were rented, and so we used rental rates, and then I kind of made a physical map and measured the square footage of both facilities, and then applied a cost per square foot based on the space allocation and space use. The community sites where rent was paid, I used the actual rental rates, and I think there was some activities that took place in public spaces, and I didn't account for those. For vehicles, I used estimated replacement cost. For resource use, I primarily used monitoring and evaluation data and supplemented that with individual interviews. Next slide. So here's a quick summary of the cost of developing the SASA materials. These costs were incurred between 2005 and 2008. And the individual categories aren't that exciting, but mostly this just shows that the majority of costs, 96%, were recurrent costs, and only 3% were capital costs in the development phase. Overall, this total cost was then applied in the intervention stage as a capital cost. So the total was annualized over the expected useful life of the SASA materials. And I think I varied that in sensitivity analysis as well, and I also divided this by the number of rollout sites that were using the intervention materials for each year of the intervention. Next slide. This is implementation costs over the 4 years. And again, the individual categories are probably not that interesting, but in total, recurrent costs made up 98%, and capital costs were a really small proportion of the total cost. Overall, for 4 years, it was about $546,000 US, and that's 2011 US dollars. Next slide, please. So here are the unit costs. So our target intervention, or our target population, as I mentioned, was people aged 18 to 49. So looking at that population specifically, it was about $21 per person over the 4 years of the intervention. So the annual cost of that was $5 per year to reach people in that target group. If we think about the effects might have been felt in people younger and older than that, I looked also at the number of people in the community aged 10 and up and aged 15 and up, and those unit costs there are about $16 and $18 respectively. We also looked at the cost per, so I've called it here community stakeholder supported, because this includes activists and community leaders and local religious leaders. So they're all kind of grouped together, and Raising Voices and CWIP don't call these individuals volunteers. They call them, and it's more than just activists. So we went with the term community stakeholder. So over the 4 years of the intervention, the cost per supporting each stakeholder was $1,500, and then per year it was about $400. The cost per activity was about $50. But as I'll mention in some of the challenges, but I'll just point to now, we didn't have really good estimates for the number of activities, so I varied this a little bit in sensitivity analysis and just show how those costs might change. Next slide, please. So overall, for the cost effectiveness, our outcome was cost per past year case of physical intimate partner violence averted. And the trial results, the main analysis for the trial was done using a 95% confidence interval. And in this analysis, this particular outcome wasn't statistically significant. And there was a number of reasons for that, which are described in the paper. But so for this analysis, I used a 90% confidence interval. And so the range in the cost per case of violence averted was between about $330 to just under $1,000 per case averted. And you'll see how I varied this in sensitivity analysis. Of course, it's most sensitive to the assumptions around the number of cases averted, and not very sensitive to the number of rollout sites that are using the materials or volunteer time. Discount rate and how long we assume the SASA materials last are not that important in terms of driving costs. I did want to point out here that one of the other important outcomes was number of cases of sexual violence averted, and we had some discussions around whether to include these individually or additively or separately, and in the end we weren't sure that the cases of violence, sexual and intimate partner violence, could be averted in the same person or in two different people. And so we thought that if we combined the numbers of cases of violence averted just by adding the two together, then it would be double counting in some cases. And so for simplicity and coming up with a conservative estimate, we just stuck with physical violence. Next slide, please. So overall, some challenges. For me, primarily, it was retrospective data collection. And I mentioned I went to Uganda to do the data collection, and there had been quite a bit of staff turnover there, so I wasn't able to interview staff who had been involved in early implementation. There was missing data around the number of activities. I think they only really recorded the number of community activities that were completed for the last 2 years of the intervention. So I had to retrospectively estimate for the first 2 years of implementation how many activities were likely conducted. And because the intervention was over, I couldn't observe any of the activities as they happened in the community, which is something I normally would like to do to get a better sense of how the intervention actually works. And because of the design of the intervention, the aim of it isn't necessarily to link direct or indirect exposure to outcomes. And I think that would have been, it's something that was sort of generally measured in the N-line survey, but wasn't really robust enough to use for the cost effectiveness analysis. But I think that would have been a nice piece to add in the analysis. As I've mentioned, there were multiple trial outcomes, and it wasn't possible to incorporate into a single measure, and we looked a lot into whether it was practical to try and convert some of the outcomes into a DALY, and in this case it wasn't, so we stuck with the unit outcome of cases of violence averted. And as I mentioned, the primary outcome wasn't statistically significant at 5%, and so we did use a 90% confidence interval for the final analysis, which actually we expected might be criticized in the final publication, but it was never commented on. So that was fortunate. And I think that's all I have for now. I'll leave it at that and maybe address some questions I've seen popping up here. Thank you.
So Christine, that's great. I think if you could answer Mar's question, how did you estimate the cases averted? So you're counting something that didn't happen. How do you count that?
Well, there was, because this was a actual trial design, there was a baseline and end-line survey. And at the end line, people were asked about their experiences with physical and sexual violence in the past 12 months, and the difference between what would have been expected based on the prevalence at baseline compared to, so we, using the baseline prevalence numbers, we calculated what we would have expected at end line, and then what was observed at end line was basically subtracted. We counted that as a case averted. It's important also to point out, I have it in the slides here, but that the intervention was run over 4 years, but so there would have been cases averted in years 2 and 3, but we only really felt like we could measure the last 12 months. Okay,
great. And I'm going to hold on to the other questions just a little bit longer because they weren't very specific to any one presentation. I think they cut across. So just this is the infomercial part. So just wanted to make people aware of a resource that's been developed under the Passages Project. It's a primer for the costing of social norm interventions. And what you see on the slide here is really the topic areas, the broad topic areas that are brought into that. So we start with trying to orient people. Really the intended audience is people who are not usually doing costing. So why do we care about costs? What are they? Where do they come from? So tying them back to resources. Questions about resource or cost measurement, and we saw some of that in some of the presentations talking about how did you measure time use. Prashant specifically was talking about some of those issues. The timing, this issue of retrospective versus concurrent. We actually make a case or plug or endorse taking an activity-based costing approach, and many of these studies were doing that. It seems, particularly for an intervention where there's discrete things happening, you have a project timeline, you can link those to specific activities and try to build your cost estimates around that. There's a section talking about how do you report the results of the cost estimation. And this is really, I think, part of the challenge we face because other external users are very tempted to take different cost studies and try to compare them. And often there's not enough detail being reported that makes those comparisons necessarily true. And if Mead Over was here, he'd say, that's why we need cost functions. We need to report cost functions. Well, people aren't doing those, and there's lots of reasons why they're not doing cost functions. And then we got the last section talks about additional potential cost analyses, and in that section we do talk about cost effectiveness analyses and more further applications. But I don't want to spend too much time on this because I know people want to talk, and I know some people are going to have to run. So I don't know, how are you going to handle the discussion? Do people need to raise their hand? Or are you just going to open up all the microphones?
So I think we have some questions in the chat already. So I think if you might want to address those, and if anybody has additional questions, we can address those in the chat. And Rick, maybe you can moderate, and we'll open up to the panelists.
Okay. All right. So I'm just scrolling up here. Lori Bullinger had a question from the Married Adolescent Activity. Were the budgets submitted used for the costs, or were they just a jumping off point? So that's a very specific question.
Sure, this is Bram Brooks from Pathfinder. Can folks hear me?
Yep.
So yes, we use the budget as a starting point. Our financial system at Pathfinder allows us to capture, monthly financial expenditures. And early on, we were able to structure some of the specific interventions that are found in the various districts. So we're able to structure our financial systems and run monthly financial reports. I think the challenge that we found, and I think this was noted by some of the other presenters, are associated with some of the subcontractors. So in our case, Lafia Matassa, who aren't using financial systems from Pathfinder, and trying to tease out some of their expenditure proved to be challenging.
Okay. All right. There was a general question from Christina Bering. How do you get data on outcomes and impact and then compute what such costs? For example, what if your interventions costed out were not affected? You would have to do costing of a modified intervention. So there's a lot in that question, Christina. I think from my perspective, one of the challenges with cost effectiveness analyses is the context, and I think this was pointed to by Jen brought up the context and generalizability, but I think Sergio also discussed this challenge because he's doing across multiple countries. It's very tempting to think that there's some universal truths out there, and all we have to do is find those, and what works in place A will work in place B. But the reality is context does matter. And when you do these cost effectiveness analyses, you want to try to control for the contextual facts or the scale effects. So often what people will do is they'll standardize and say, okay, we're going to look at costs and effectiveness for a hypothetical cohort of a certain size. So at least you've treated the size of the cohort being reached, you've standardized on that effect. But there's a lot of different challenges. I mean, we don't have time. We could have a whole nother webinar on how to do a cost effectiveness analysis. But I think that's part of the challenge you face. Now, if your intervention wasn't effective, often what you find is that people don't care anymore about what it costs. And this has happened to me in studies before where we were doing a multi-country study, intervention in workplaces, and they had no effectiveness measure. And they just told me, you know what, we're not going to report on the costs either. So, but that's a risk you take. I think one thing that we didn't talk explicitly, although this is a little bit related to Jim Rosen's questions about design costs, we also, and in the primer talks about this, if you're doing these analyses within the context of a research program, you really want to try to isolate or remove those research-related costs from the analysis if your target or your goal is to inform the program staff, because they're not going to run a research study. They're going to just do the interventions. But Jim's specific question was, well, when you design, say, a curriculum or an intervention and you're going to capitalize it or amortize it or discount it over its expected useful life, is there any standard for what that useful life of a curriculum or intervention that's being designed would be? And I'm not aware of an international standard for that. I don't know if any others have heard of one.
No, not quite, but that's a question that's going to come up for us because the interventions in Rwanda and Ghana are adaptations of SASA. So we do have costs of SASA, which Christine presented. So that is a question that we will come up against. I think for us also, and linking back to the other question, is we costed quite specifically as well the cost of adapting SASA in the particular country. So I think it's good to separate those costs, and as well in relation to the effectiveness question. If the intervention is not effective, this is why we also want to get intermediate unit costs, so cost per person trained, cost per training session, et cetera, which can then be used as building blocks later on, should this not be effective, but a different trial measure, a similar intervention, but with slightly different elements.
Right. Okay, thanks. Jim had a follow-up question about the, what's specific to the costing of social norm interventions. I'll share my perspective, but others please weigh in. I think the approach to costing is not unique, but I think where we really get into challenges with the social norm interventions is what we were talking about earlier in terms of this measure of effectiveness, because there may be these lag effects. You may not be able to measure a detectable difference immediately, but in some ways you could think about it as an inoculation, or you're hoping to inoculate from future problems, whether it's intimate partner violence, whether it's unplanned pregnancies. So I think that's part of the challenge, is if you want to try to push these from this is what it costs to support and keep a social norm intervention in place and running versus what's the cost per pregnancy averted, or what's the cost per intimate partner violence act averted.
Hi there, this is Christine. I just wanted to add in now with respect to the question about useful life is I did vary this in sensitivity analysis. So we assumed based on discussion with Lori Michaud, who developed the curriculum, how long she thought that the materials could be used before she would want to update them. And they had already been used for about 3 or 4 years at that time, and she was thinking, well, probably now there's a few things that I would change or like to update. So I estimated based on that, that for the base case analysis, the useful life would be 4 years. But I also, in the sensitivity analysis, reduced that to 0. So that would assume that it's just a one-off intervention that you wouldn't use again, and then extended that to 20 years, assuming that you would use the same intervention materials for 20 years without putting any resources into updating those materials. So that's what I did, and I don't think there are international norms, but that's how I came up with the numbers. And I did find, I should say, that the numbers that I used for the useful life for the materials in particular did not influence unit costs substantially.
Okay. Continue to scroll down. There's a question about the use of measuring unit cost per person in the target areas, but also per stakeholder supported. And I think this is also from Christine, your presentation. I think one of the, and I'll comment and then let Christine reply to this specific question, but I think we, and I think Prashant also was looking at a cost per person estimate, but I think, these interventions are not typically delivered at an individual level. They're delivered at a group level. So I would encourage us to think about what is the right collective, because there is this issue of fixed and variable costs, and you have an average total cost curve, which you're working your way down. At some point, you're achieving economies of scale, and you don't want your results to be dominated by you're operating at a low scale, so you have high unit costs versus a larger scale. So trying to think about the natural unit, and I think early on in Francesca's presentation, you're talking about congregations. That's an obvious cost target. You say, well, what does it cost to run this intervention for a church as opposed to for an individual? And recognize that churches are going to have different sizes, but the marginal cost or the incremental cost of another person participating within that church group is probably quite small. So that's another way to think about it. But Christine, did you want to respond related to SASA?
Yep. So for SASA, the number of community members was based on community surveys, which were household surveys, and there's details related to the sampling in the paper. Actually, I should have mentioned that the full results are published. So if you're interested in more detail, you can find the published paper. It's on PubMed, or you can Google my name and SASA or something like that, and you'll find it. The stakeholders was actually a specific definition, and it wasn't just broadly community leaders. It was people who had specifically been recruited by SASA and had SASA training and were using SASA materials in their interactions with people. And I mean, so it sounds like a specific definition, but and in some ways it is, but it is also a little bit loose, because we're assuming that once people have received training, so there's a particular group in Uganda of community leaders called Singas, and they often participate in things like marriage counseling and dispute resolution. And so they received some training in the SASA materials, and so then the expectation is that they somehow incorporated that into their everyday kind of activities, but we couldn't possibly measure the extent to which they did that, and the extent to which that was effective. So we assumed we just count them as a body of people who received training. But again, the difficulty, which I think relates to one of the other questions there in terms of what's unique about social norms interventions, is that there's difficulty in attributing action to change, and then quantifying the change in a measure that can be expressed in a unit cost or cost effectiveness type of output.
Okay. Okay, Francesca is jumping off, so I was going to give her an opportunity to say more about the transforming masculinities and the cost target, but okay. All right, I think a couple other things that struck me as I was taking notes as people were presenting. I think this issue of as I said, generalizability cannot be discussed too much. I think we really need to understand, and I think when in the section of the primer where we talk about reporting the results, I think often what's missing, and some of it is journals and not giving people space, but it's really the detailed description of, well, what actually was done. What did that intervention look like? Because when you boil it down just to this one number, and that's always the risk, is people say, well, that intervention costs, $20,000. But you don't really know what you got for those $20,000 unless there's a detailed explanation of what that intervention entailed and why did it cost $20,000. What's behind that $20,000? But it's hard to get the space to go into that detail. People often, I work with a lot of people that say, okay, I just need a table. Can you, with the cost results. So I think we need to, as people who do cost analyses, I think we need to continually push back on that and say, well, this isn't going to be very useful if this is all you have. You're going to need some additional context so people can interpret those numbers and understand why those numbers are what they are. So that's my little soapbox as we hit the 12:33 mark. Are there any burning issues that people want to discuss? I think I got to all the questions that were posted.
Okay, so thank you everywhere where we've reached the 12:30 mark. Thank you so much, Rick, for moderating, and thank you very much to all of the panelists as well as the participants for sticking through with us. And I hope seeing this range of different costing experiences was interesting to you. We'll be following up and sending out the slide deck, as well as a lot of the resources that we mentioned to all of the registered participants. So you'll have those available. And once again, thank you very much. And well, have a good afternoon, evening, morning, and we'll be reaching out to you soon.